Hi, my name is Amy and I will be teaching an introductory portion of the care of postoperative surgical patient within a medical surgical course. According to the American College of Surgeons, post-op complications pose the greatest risk for 30-day hospital readmission among general surgery patients rather than medical issues. In order to understand the needs of the postoperative patient or post-op surgical patient, we must first have an understanding of what some of the common post-op complications are. If we know what complications may occur, we will have an understanding of the assessments and the monitoring that needs to be performed during the post-op period. This graphic represents 5 of the major post-op complications and what we as nurses should be assessing our surgical patients for following surgery. Treatments will be discussed later in this unit. The first complication is shock. Shock is inadequate tissue perfusion that leads to decreased blood flow to the vital organs, an inability to properly use oxygen and nutrients, or the inability to rid tissues of waste material. Hypovolemic shock, which is the most common type of shock in post-op patients, results from a decrease in circulating blood volume. Symptoms include decreased blood pressure, pulse, urinary output, cold, clammy, pale skin, and lethargy. The second complication that can occur postoperatively is hemorrhage. Hemorrhage is the excessive loss of blood. This blood loss can occur internally from a blood vessel that is not sutured or cauterized, or externally from a drainage tube or wound. There are, of course, other causes of hemorrhage, but these are the 2 most common postoperatively. A serious hemorrhage can lead to hypovolemic shock, which we already discussed. Obvious signs of hemorrhage include oozing dark red blood if the source is venous, or bright spurts of pulsating blood if the bleed is arterial. Other symptoms include restlessness and anxiety in the early stages, and the same symptoms of shock later on. Another complication is deep vein thrombosis. DVT or DVT. DVT is the formation of a blood clot in association with inflammation in the patient's deep veins, mainly those in the lower extremities. It may occur due to many factors, including trauma during surgery, pressure applied under the knees, or sluggish blood flow during and after surgery. Certain risk factors place patients at an increased risk for DVT as well. Signs and symptoms include patient complaints of leg pain and swelling in the affected extremity. Additionally, an examination may reveal redness, edema, and an increase in temperature. The fourth post-op complication is atelectasis. Atelectasis is an incomplete expansion of or collapse of the lung tissue resulting in inadequate ventilation or retention of pulmonary secretions. It can occur from decreased respiratory effort and decreased urge to cough following anesthesia. For patients who have had chest or abdominal surgery, pain may prevent them from wanting to take deep breaths, causing this collapse. Signs and symptoms include dyspnea, diminished breath sounds over the affected area, anxiety, restlessness, or cyanosis. The last major complication is pulmonary embolism. Pulmonary embolism is a dislodged blood clot or any other substance that lodges in the pulmonary artery. It can occur following surgery if a patient has a DVT that dislodges. Signs and symptoms include dyspnea, chest pain, diaphoresis, anxiety, restlessness, tachypnea, tachycardia, cough, or cyanosis. Severity depends on the degree of blockage, and sudden death can occur sometimes. Now that you know these 5 complications, you will have a better understanding of your nursing assessment and management following surgery. Your nursing care can be aimed toward preventing or minimizing any of these complications. This concludes your introduction to care of the postoperative surgical patient. Thank you.